Hello, welcome to Lifetime Dental and your Filthy Mouth podcast. We're so glad that you're here. Dr. Chuck from Lifetime Dental joining us. Hello, Dr. Chuck. How are you today?
I'm doing really good.
Good.
It's a good day. Yeah, the beautiful weather outside. We can complain about a lot of things, but we got a lot of good stuff going on too.
We sure do. And I want to dive right into that positive stuff. I'm feeling like we may be getting on the other side of this. And what does that mean for your patients and for your office, and everybody involved?
Well, the answer still is we don't know. I mean, originally we were told to be closed until at least May the 8th, which is a Friday, and then possibly opening up on May the 11th, which would be a Monday. We'll see if we can still do that. We don't know at this point, but things are looking in that direction. So that would be nice.
It is nice. I just feeling positive. I mean, some of the beaches are opening up and, everybody's got a different opinion on it, but it's been an opportunity. I'll say that. I mean, I was originally going to go into hairdressing and I had a chance to cut my bangs by myself, which you can tell, I'm sure. Maybe it is time for everybody to open like hairdressers and stuff.
Well, I'm overdue for a haircut myself. I see a comb way back behind there. You can't see it, but it's just about a ponytail.
Well, as we anticipate opening up, what kind of things are you having to consider now that you never had to consider before?
Well, the first thing we want patients to be aware that when they do come into the office, they're coming into a safe environment. I've got a list of, let's see if I can hold this up here. This is Return to Work Interim Guidance Tool from the American Dental Association. There's, I don't know how many pages are here, but quite a few of what we need to do to reopen. A lot of it is going to be, people are going to notice it when they first get there. There's no magazines or goodies in the reception area. That's kind of cleaned out. All those hard surfaces we're cleaning.
The coffee's gone.
Gone. It's like, oh my gosh. No, right. Some of the back, yeah, that's my go-to. For taking the risk of virus on there. But we're going to be taking everybody's temperature before they get in. We're going to be having people fill out a form that basically says where they've been the last couple of weeks. We're doing everything we can do. Is there anything that is 100%? No, I don't care where you are. But it's all a matter of risk. Driving from your home to the office, you took a risk.
Mm-hmm.
Okay. Well, when you come into an office, you're going to take much less of a risk than driving to the office. But we want to keep it safe for everybody. I want to keep it safe for my staff, for the entire staff. We work there.
Yes.
So it's and when people come for their appointment, it's just going to be the one person for the appointment, not the whole family. But if it's a child and they need the parent or a caregiver needs to be some assisting, that's okay. But we're not going to bring the whole family in there because it's just more cleaning. There's going to be more time in between appointments because we have to disinfect the rooms, and that's going to take a little bit more time. So our schedule is going to change. There's a lot of things that are going to be changing. But the thing that's been on my mind the most is our patients, because we've got every age group. We've got over 50 patients that are 90 years old or older.
Say that number again. How many?
Over 250 that are 90 years old or older. Yeah.
That's wonderful.
Well, it is, except where you're in this lockdown situation, kind of, because a lot of they're in isolation, and families can't come and visit them in the nursing homes or extended care facilities. So it's more challenging on them. Then you got the young parents with the kids at home. Now the parents are having to learn how to be school teachers and do the online teaching for that. So it's been a switch for everybody. Is it a good thing or a bad thing? Well, we'll see.
I know that you and I kind of choose to take the positive side of things, and by this extra cleaning, I mean, when flu season comes around, the normal flu season, my goodness, look at how far ahead all these offices are going to be because they're already prepared in ways that magazines never got removed before. We never really thought of it,
Well, and what's necessary, what's not necessary, and we don't really know everything. We're learning more. That's one thing I've heard some of the commentators on television talk about. We're learning more as this goes on, and we didn't have all the information a couple of months ago. We still don't have all the information.
Sure,
but we're getting better. We want to be safe.
And Dr. Chuck, when you talk about not just the older patients that you have, but maybe the more vulnerable. I mean, it's more important than ever that they keep their immunity up, and that happens by keeping a clean mouth, not just brushing their teeth, right?
Boy, that's a big deal, and I know that's kind of my passion, is helping people understand the connection between the health of the mouth and how that affects the health of the rest of the body. But when everybody is wearing a mask, what are they covering?
Hmm.
Their mouth.
Wow. The front door, what you
Front
always say,
door.
you're covering the front
You know,
door.
keep the front door to our body. We need to keep that front door really good and clean and healthy. The healthier we keep that mouth, the more effective our immune system is at fighting things off. If you've got inflammation and infection going on, even if it doesn't hurt, your immune system is down and you're more susceptible to getting some of the diseases, whether it be uh, the coronavirus or anything else that could be coming your way.
Hmm. I think about people who are undergoing chemotherapy right now, and mommies that are pregnant. I mean, having that bacteria go throughout the whole bloodstream, that's just not good for anybody.
Well, and this, we need to keep a good, healthy, clean mouth long after this coronavirus has passed us. I mean, it's the thing that people can do right now is spend that 5 to 10 minutes every day. We can't get you into the office to do your hygiene visit for you, So if we can't do it, guess whose shoulders it's on?
I know, I missed mine. So,
Yeah, yeah.
so how is that going to work? How are you going to help people get back in the rhythm? I mean, you're going to be bombarded with patients that are missing going, "Hey, do I get to the front of the line? I need my mouth clean." How's that going to happen?
Well, there are some people that just have a greater need than others, and
Right.
so we're going to have to kind of prioritize how we phase back in our treatment.
Sure.
If someone's got periodontal disease and they've been staying on their 3 month frequency and doing their homework, they may need a little bit of extra help. Whereas if someone else they've got a good healthy mouth and then have it just regular prophies a couple times a year, they might
Hmm.
not need it as quickly. Now, do they want it? Absolutely, people want it, but we only have so many chairs and so much time, and that's going to be really important for people to, when you make your appointment, please keep it, uh,
Mm,
because they're at a premium right now. We're
yeah.
not going to be able to have as many appointments per day simply because we have to take time to disinfect the rooms. Very different from what we did in the past. So it is going to take a little bit longer. There will be fewer appointments, which makes every one of them more valuable.
So when we're talking about that's the regular routine, the people who just keep coming in, every 6 months, every 3 months, or whatever as needed. But what about friends who have emergencies? I've got a friend up north that was saying that he's got a terrible toothache. I'm like, oh boy, well, that
Yeah.
qualifies to go into a dentist, right? What are some of the things that would
Well,
qualify people to get in now?
I got to tell you, I'm pretty proud of our patients because I've gotten a lot of phone calls over this time, and usually it's a friend of a patient. They're
Mm.
referred by a patient, but most
Oh,
of our patients have not had these emergencies. Most of our
mm,
patients are doing a lot of the things they need to do. Now, there's been a couple of crowns that have come off, and maybe a
sure.
broken tooth here or there. But as far as these type of swelling, emergency, infection, pus, all that stuff, most of them are not from existing patients. Uh,
Hmm.
and so, again, I'm proud of our patients. But a lot of times, what we can do now is we can talk to them. We're still, I hate to say it, our web company is a little bit slow.
Okay.
We've been trying to get the teledentistry forms on the website so people could do it. We have the information done. It's just a matter of them um, getting it up on site. But
Mm,
we'll be able to do teledentistry, which when people get online, it'll be on the website. You got to jump through a few hoops.
yeah, I'm sure. Yeah.
You might not have to come into the office, but you're still going to have paperwork. So there's like 5 different forms that you have to fill out. You can do it all online, and as you finish one, it'll send you an email and bring you to the next, and send you
Hmm.
email, bring you to the next. And when you're all done, then we just set up a time where we can have a video conference chat. So we can do this for new patients that I've never seen in the office.
Wow. I mean, that's huge.
Yeah, it's a big deal.
Yeah.
So if you're an existing patient, it's no problem. I've got your paperwork. If you're a new patient, this way we can get it, and that way we can actually do a face-to-face consultation.
Hmm.
It's amazing how many times we see a patient, and this is back before the coronavirus, but they'd come in with a toothache, with a problem. And first thing we have to do is put them on antibiotics, get the infection under control, and then
Mm,
back into the office so that we can work on them. Well, we can eliminate that first in-office visit by doing teledentistry. We can talk to them, get them on the antibiotics. So then when they do come into the office, there's no more infection going on. We're able to begin work that day. So
wow.
yeah, so there's a lot of advantages to this. Plus, if we have someone that does have a toothache, if we can, a new patient that we haven't met, I can see them face to face. We can put them on an antibiotic, get the infection under control, and then just kind of hold on that way until we're able to physically see them.
That, I mean, by putting them on an antibiotic, that's probably going to cut down on a lot of pain too, right? So
Well,
not
yeah,
being able to get in, yeah.
that's one of the people think that I got a toothache, I need some pain pills.
Mhm.
No, you have a toothache because you have an infection. When we
Mm,
infection under control, the pain pill, you don't need the pain pills. The pain goes away. And you don't always need opioids for your pain medication.
right.
One thing that works really good is like 2 Tylenol and 1 Advil at the same time. Oh my God,
That's
that works fantastic. If
real. That,
but if you don't need it, don't do it, you know?
yeah. And that's just kind of a holdover. Just talking about the telemedicine, I think that's really exciting because a lot of us don't go for a second opinion to doctors when we're told because, oh my gosh, more expense, another day off work. I mean, this is going to change. This is going to revolutionize second opinions, right?
Well, this way, if the patient has already, the person has already been to see a dentist and they've taken X-rays, they have perio charting, they have all the information, they can forward that information to me or to another dentist, whatever they want, and get a second opinion, and then we can actually visually talk to each other and um, find out what are your goals, because that's one of my first questions with new patients is what can we do for you? What are your
Mm,
goals?
mm,
Not here's how I can help you, because uh, once I know their goals, I can give them that information. But if I don't know what their goals are, and the first thing I'm trying to do is sell them a Hollywood smile,
right.
maybe that's not the goal they had.
Mm,
So usually the goal is I want to be healthy. I don't want to have any infections. I don't want to have any toothaches. I want to hang on to my teeth. That's a pretty normal one that we hear. Sometimes the treatment plans people are giving are for something other than that. And so this is why it's worth getting a second opinion to find out, is that really what I need? Or,
mm,
what are my choices? And that's why,
mhm.
again, it's non-confrontational. I'm not doing any really diagnosing. I'm just talking about options that people have, make them aware of what the particular choices that we have.
And don't be afraid. If you've got an issue, you can go into Dr. Chuck. I mean, now, like, talk about some of the emergencies. If your child falls down and loses a tooth, they can come in, right? I mean,
Well, there's certain things that you can come in, but most things you really, and that's why I'm so proud of our patients,
yeah.
is there are very few real emergencies that we've had to deal with. There's a handful,
Okay.
but we've been able to deal with those easily.
That's
So
great.
yeah.
That's great. But pain, call, right?
Oh, yeah, absolutely.
Yeah.
Pain is generally an indication of infection. Infection means you're dumping pus through your bloodstream. That's
Mm,
not okay.
mm,
That's just not okay.
mm.
So
All right. Well, let me take a drink of coffee here. Oh, well, look at that. Look what cup I
oh,
have. You know, people would think we actually talked about doing that, and we did not. But
nope.
these are your filthy mouth mugs. And I just want to encourage you, go to the website. I don't know if you can see this or not. And if you're in Tavares or Lake County, you may have seen the billboard with the woman with the hands over her mouth and it says your filthy mouth. It's a clean billboard. It's Dr. Chuck. And he talks about what happens in your mouth, how it's affecting the rest of your body. And look, if you're pregnant, if you're on chemotherapy, if you're an older person, if you have heart disease, if you have physical ailments, please go visit yourfilthymouth.com because chances are real good we've got an episode and a show on that. And I can almost guarantee you're going to be surprised by what you learn. I learned something new every show that we did, and it's just vitally important.
Well, and thank you for helping me spread the word, because uh, it seems like there's I call it the deadly gap between physicians and dentists, and
Mm.
physicians were just never trained to include the mouth when coming up with their evaluation, their diagnosis of what's going on with the patient. So I mean, the question is, when was the last time you had a physician ask you about your mouth, the health of your mouth? They might ask, do you see a dentist? or
Hmm.
seeing a dentist, but that's generally about as far as it is.
Hmm.
There's so much more. Do you have gum infection? Do you have tooth infections going on? Is your bacteria that's being dumped into your bloodstream? Um, the general physician really should have that information. But until we have a better communication, it's up to the patients to make sure that they inform their physician about their dental health. Now, what we do in the office is whenever we find an infection going on inside a patient's mouth or something that the physician should be aware of, we fax that physician a letter right away and let them know what's going on. But I don't know what happens to that letter. I don't know
Mm.
if the physician looks at it, if they put it in the circular bin. Um, I don't know. But people need to be aware that oral health plays a very big role in your general health. And when we're looking at compromised bodies because of this coronavirus, man, you need everything going for you that you can.
Mm.
You know?
Yeah, absolutely. And I'm thinking about all the stories you've shared with me over the years about people who have gotten off high blood pressure medicine and off medications because it was a problem in the mouth.
It's interesting. I've been practicing here for a little over 40 years, so I've seen a lot of changes. This is back when I started dentistry. You didn't wear gloves. I mean, that was nobody did.
Wow.
In dental school, nobody wore gloves unless you're in the operating room. Then you wore gloves.
Mm.
But things have changed a lot along the ways, and we look back and you see the way people were not made aware of the links of what happens in the mouth and how it affects the rest of the body. We were not taught that in dental school. And as time has gone along, we've learned this information. Now we need to pass that on and we need to make this implement into our daily activities, into our
Mm.
routines. So
Mm.
that's what I like to see is the mouth being included with the physician, to where the physician says, "Hey, tell me about your dental health.
Mm.
Dentist, can I get a report from your dentist?" And then get a report. And then now
That
we're
will be
the
a
dots.
that'll be a wonderful day when that happens. I believe it's going to be when it happens, not if, you know. But we want to encourage you, yourfilthymouth.com. You can also visit on Facebook. And as a matter of fact, if you ask a question, we use it on a future show. We'll go ahead and send you off your Filthy Mouth mug. Dr. Chuck, I want to send you off with one final thought, and that was that you were a birthday boy last week and how fun it was to be part of your special celebration. Do you want to talk about that?
Oh, absolutely. Let's start by saying I have a fantastic staff. They are they're amazing in so many different ways. We're like a family. And of course, my birthday was last week, and I was sitting home. In fact, I was sitting right where I am right now doing stuff on the computer. And I got a text message on my phone, and it said, "Go outside and turn on your movie camera." I go, "What?" Go outside. So I went in the backyard and I'm looking around for nothing. So I looked out in the front. And I couldn't see anything. I went back inside and I texted back a big question mark. And they said, "Are you outside?" I said, "Well, yeah, in the backyard. We go in the front yard. Okay." So I looked down the street and there was a parade, a birthday parade, and it caught me completely by surprise. And so I did video it, and they had cars and honking and kids and balloons and streamers, and I don't think I've laughed that hard in a while. That was
That was so
it
fun.
caught
We
me
are
by surprise.
we are playing it right now, as a matter of fact. We are showing the audience about how loved you are.
Well, it's a great team. It's just absolutely fantastic team, and I tell you, it's just like so many people in the whole across the United States, we had to furlough staff. We kept things going as long as we could,
Yeah,
but
you
when
did.
income going on into the office, it's hard to keep paying. We've applied for the PPP loan that's out there, and we're still waiting. One of those offices that are still waiting,
Yeah.
but it you have to do what you have to do, and so we can't wait to get back to work and help our people get back into good health and let's start a few smiles instead of frowns.
I like that. That's a perfect note to end on. Thank you so much for your time today, and we can't wait to get in person with you and get our mouths cleaned and maybe revisit on the other side once you're finally officially set up with telemedicine and maybe have a little bit better idea of when you're going to be opening again.
Well, you can keep checking back on the website, which is lifetimedental.us. Keep checking there, and there's some links they just haven't put on there. We've been waiting and waiting and waiting. As soon as we get them, then it'll make it a whole lot easier for everybody to get a dental appointment without necessarily leaving your house.
Love it. Thank you, Dr. Chuck. Have a great day. We'll talk soon.
Thanks so much, Suzanne.
Thank you.